Medicare for All system will save lives, it will save money, and it will end the frustration and endless paperwork, denials, and desperate fights with an insurance company to cover medically necessary medications and procedures. Medicare for All critics tell us that Americans just love their private health insurance companies. You know what? I have never met one person who loves their insurance company.
Do the American people want Medicare for all in my proposal? That's what we should be debating.
Bernie Sanders and Joe Biden represent opposite ends of the 2020 debate over health care. Sanders is campaigning on Medicare for all, while Biden is focusing on improving Obamacare. Our CBS News Battleground Tracker finds 56% of Democrats in early nominating contests support a Medicare for all plan. 37% say it depends on cost and details. 7% oppose it altogether. But an overwhelming majority of Democrats, nearly 90%, agree health care is a key issue in 2020. In a recent story, New York Times national health care correspondent Abby Goodnough writes, though Democrats owned the health care issue in 2018, pointing a way forward, tear up the current system and start over, or build on gains in coverage and care that the Obama health law achieved, is proving tricky for the party's presidential candidates. And Abby joins me now from Washington. Abby, thanks so much for being with us. Take us through the differences here. What does Sanders' vision for coverage look like, and what is Joe Biden's?
Well, Sanders really wants to completely overhaul the American healthcare system and take away private insurance completely, eliminate it, and give everybody coverage through a government plan with what he describes as very generous benefits above what Medicare provides to the elderly now. Biden, on the other hand, he wants to expand on Obamacare, including the new thing under Biden would be offering what he calls a public option. But that would be similar to Medicare, and you could choose that and buy into it, but you would also still have the option of keeping private insurance if you preferred.
So most Democrats in the early states support Medicare for all. How are other candidates approaching health care?
So the candidates, they're generally either falling into some version of what Bernie Sanders wants to do, Medicare for all, or Joe Biden and the public option. Senator Elizabeth Warren and Senator Sanders are the only two who have sort of full-throatedly said they endorse getting rid of private insurance completely. There's a couple. Biden is leading the more cautious crew with the, building on Obamacare and creating a public option in addition to Obamacare. And then you have a whole bunch of middle ground people who essentially say they like the idea of Medicare for all and getting to a place where we wouldn't have to deal with private insurance, but they don't want to get rid of it completely for now. They want to keep it as an option for now because people don't like change. And the polls suggest Americans generally are uncomfortable with the idea of ditching private insurance completely.
Well, we also asked Democrats in early states which health care message could win over swing voters, and most said lowering costs. 26% said protecting pre-existing conditions, and 23% said starting a national insurance program. What do you take away from those results?
Well, I think it's interesting that that more people chose lowering costs over those other options as the most important. If you're listening to Donald Trump right now, he too has shifted to talking about lowering healthcare costs. It's something that he, as far as healthcare policy goes, that's what he has seized on, especially prescription drug costs. So he clearly sees this as fertile ground and something a lot of people are upset with and want to change. And I think the Democratic candidates are realizing that too. One way of lowering costs certainly is to lower the cost of insurance. So that's part and parcel of what the Democrats are trying to do.
Well, when you look deeper at healthcare coverage isn't the only issue voters are focused on. Democrats in early states said out-of-pocket costs, such as co-pays or the price of prescription drugs, ease their leading concern. So what does this say about how candidates should frame their healthcare pitches?
Well, certainly in terms of out-of-pocket costs, I think all of the Democrats are working on proposals for lowering drug costs. One problem with proposals about lowering drug costs is that they can be really hard to explain and understand. You get pretty in the weeds talking about prescription drug cost policy, and I think that's a challenge for everybody, Trump included. But drug costs is going to be part of it. Surprise medical bills, a lot of people are talking about getting rid of those. I think that for the Democrats, they're still very focused on expanding coverage because there's still a lot of people in this country who don't have any health care coverage and thus have a hard time getting health care to begin with. And you will see the Republicans focusing more on costs and not so much on insurance.
Well, on the Affordable Care Act, in a piece last week, you wrote this, that the Democratic-controlled House voted almost unanimously to repeal a key tax that would help pay for Obamacare. Why did this happen, and what does it mean for coverage?
Well, it happened because this was never a popular tax, never a popular way to pay for Obamacare. Health economists loved it because they really do see it as a way of slowing the growth of health costs, which is a really important goal and was an important goal of Obamacare. But the problem is it was, even now for the past few years already, making employers worried enough that they were raising deductibles and making their health benefit policies less generous. And, Democrats as well as Republicans heard earfuls about that from employers and from workers who are getting stuck with higher deductibles already. So I think they figured this is a tax that we've delayed already for a number of years. It's likely to potentially never go into effect anyway because we're going to keep delaying it. So let's just repeal it, and that will be a popular thing to do.
All right, Abby Goodnough. Abby, thanks very much.